From the RSNA, this is the Imaging Cancer Podcast, and my name is Dr. Lauren Burkard-Mandel, and I am an R4 diagnostic radiology resident at Case Western Reserve University, University Hospitals in Cleveland, Ohio. Today we are going to explore a topic that is near and dear to my heart, women in radiology. It is well established within the field of radiology that despite the fact that slightly more than half of matriculating medical students are female, it remains that only about 25% of radiology applicants are female, with a similar fraction of female practicing radiologists throughout the country. A 2022 study in radiology demonstrated that while 38% of radiology instructors are female, this number decreases as you ascend leadership roles, with only 17% of department chairs being female across the country. Moreover, the article goes on to detail the lack of racial diversity in radiology, stating that only 5% of department chairs were Black nationwide, and only 2 to 4% of associate or assistant professors were Black or Hispanic. In 2019, the ACR released a diversity report which founded a Commission for Women in Diversity with a stated mission to embrace and advance diversity and inclusion through equity, access, and innovation for the benefit of our patients, our profession, and the American College of Radiology. Women in radiology groups were identified as a key component to this mission, which have been founded across the country to foster mentorship, leadership, recruitment, and advancement of women in radiology. For me personally, women in radiology has enhanced my residency experience exponentially. It has connected me with mentors and helped me to feel supported throughout my training. Women in radiology has offered countless social events and opportunities for personal and professional development. One of my favorite programs we run at our institution is called Spotlight Lunches, where we discuss career trajectory and lessons learned with female leaders within our own department as well as from outside our institution. Today we will hear from 3 leaders in women in radiology and academia. These women have founded and maintained women in radiology groups at their respective institutions, have worked to increase both gender and racial diversity within our field, and have served as mentors and sponsors to countless female trainees in academia over the course of their careers. Our first guest today is Dr. Pauravi Vasavada, who is an assistant professor of radiology at Case Western University and an attending pediatric radiologist at University Hospitals, where I am a resident. She serves as the Director of Medical Student Education and is the co-director of our Women in Radiology group. Dr. Vasavada and I have worked together on many social events and spotlight lunches for women in radiology, and she has included me in opportunities that have allowed me both to identify new mentors for myself and to become a mentor to female medical students that are interested in radiology. Dr. Vasavada, thank you so much for being here today.
Thank you so much for including me in this podcast.
Of course.
Such an honor.
What is the importance of women in radiology that drives you to keep our organization alive?
So, Lauren, women in radiology has definitely been one of the highlights of being a radiologist in this department. So, I feel like our group has received a tremendous amount of support from the department leadership, allowing our female residents time away from the reading room to attend professional development events. I feel like is a real testament to the value that we bring to the department. It's very gratifying to me personally when a medical student tells me that they chose to interview with us because of the WIR video we shared online, or a female resident expresses that she selected our training program due to our strong commitment to supporting women. Without WIR, I know I would not have nearly the same level of connection and interaction with the women in our department that I do have.
Yeah, I can't agree with that enough. I think women in radiology has allowed us to get to know each other better. For me personally, has helped me identify so many mentors. And I think, especially with our community radiologists, it's been nice to get to know the women in the community because we don't work with them as attendings, but they have a lot of valuable experience. So I think that's been really a fun aspect for me too, in terms of engaging with other women in radiology.
And I completely agree with you. I mean, even as an attending at main campus, I have no opportunity to interact with the women in the women radiologists in the community. And if it wasn't for these events, I don't think our paths would ever really cross.
Yeah. And they offer all perspectives offer so many mentorship opportunities for the female residents in our department because everybody has different interests, different goals. And so that perspective of kind of being a little bit further from academia and being in the community, or our attendings here who are doing research and really involved in academia, both of those mentorship opportunities, I think, are really important for young trainees.
I completely agree. To see many different ways of how a career can play out.
Yeah.
It's so vital.
Yeah, definitely. And that kind of brings me to the role of women in radiology groups in promoting diversity within radiology, career diversity, gender diversity, all of.
Oh, absolutely. And it's been so talked about and described in our field what some of the challenges are. And I think one of the challenges that our field really faces is increasing the representation of women in radiology. Although most medical school classes are fairly equally divided between men and women, there are a disproportionate number of men in radiology residencies compared to women. I mean, look at our own, right?
Yeah.
And since radiology electives are not part of the core curriculum at many medical schools, students may not be exposed to diagnostic radiology to any significant degree until they've picked another specialty to pursue. So, I think that WIR groups really play an important role in introducing medical students to the field of radiology much earlier in their training. Being able to include female medical students in both social and professional events allows them to learn more about the field, to network with residents and attendings, and as you mentioned, find, potential mentors down the line.
Yeah. And for me personally, when I chose radiology, it was because of a radiology elective that I took. And I remember the day that I thought I could really see myself doing this. And it was the day that I rotated through breast imaging. And it was an all-female reading room at that day. They actually do have some male attendings, but the day I was there, it was all, an all-female reading room. And I thought I could really see myself doing this. And I think that was a big part of it. Not just, I found radiology interesting up until that point, but I think when you can see yourself in the attendings you're working with, that really makes a difference. So I think it's really important for medical students to have those opportunities and identify with female radiologists, because otherwise it might feel like a field that's a little bit unattainable.
Absolutely. I mean, I had a very similar experience to you. I went into pediatric radiologist because we had a female pediatric radiology attending when I trained. And she was just so enthusiastic about the field and, kind of told me things about it that I would never have even thought to ask.
Yeah.
So she made me consider the field when I hadn't even thought about being a pediatric radiologist.
Yeah, and you see that person in that role and you think, I want to be like that. I could do that. I want to be like that. So I think it's really important in those formative years for sure. And there were certainly places I interviewed at for residency that did not have any female representation at all. As I was going through my interviews, and I thought, I don't know if I'll fit in here, Mm-hmm. So I think it's so important from a recruitment standpoint, but also just from, to increase the diversity in our field for trainees and medical students to see that diversity and see that female representation.
I completely agree.
What role do you feel that women in radiology plays in promoting work-life balance and enabling women to take on leadership roles and succeed?
So I really believe that WIR groups such as ours provide opportunities for trainees and faculty in all stages of their careers to learn from each other and have conversations that may not happen in the reading room, where really the focus is on managing the workload, right? We need to get everything done. So that doesn't leave a lot of time some days for talking and conversation. So, when I look back on my own training years, and I've been out for a very long time, I recall a time when there were few women in the department and WIR groups were non-existent. Yeah. So that really limited opportunities for interactions. Thanks to WIR, I have actually been fortunate to engage in meaningful discussions with the women I work with, spanning a wide array of topics. We've talked about professional issues, things that are important to us in the workplace, to more personal aspects, such as how do we achieve better work-life integration? How do we balance our family lives with our careers? So, I think radiology offers endless possibilities. And I believe that the core mission, really, of an effective WIR group is to provide resources, such as guest speakers, some professional development events, things that are going to support career growth. So, and I also do think that these groups expose trainees and faculty to opportunities that they may not have otherwise considered.
Yeah, I agree completely. And I think our department chair, Dr. Plecha, is a woman in radiology. And she has talked about that too, that as someone who can serve as a sponsor for women in radiology, these groups have brought about connection and conversations about those potential opportunities for her, for the women in our department. So I think they're, not just for mentorship, but also sponsorship and finding women within your department who are in a position of power to help elevate you as well. So I think that's really great. And I'm also really glad you brought up work-life balance. I think especially for myself, for young trainees who are starting families and thinking about that, it's really important to see women who have done it and are doing it and have been able to balance those responsibilities. And I've had a lot of really helpful and really meaningful conversations with the women in our departments through these events about being a mom in medicine. And I can remember a conversation you and I had actually when I was having a tough week with my kids, and you said to me, these years when they're really young, those are the hardest years of my life. And I thought, thank God I'm not crazy. That this is hard for everybody. So I think it's really important to have that support.
Absolutely. It's important to see women who have made it successfully onto the other side of all that, that they've survived it and you're going to survive it too. And also for someone who's just been through it to tell you, it's okay to feel like you're drowning sometimes. And that you're going to come out okay on the other side. And it's okay not to be perfect at every aspect of your life, every moment of every day. That, some days your family is going to take priority, and there's going to be other periods in your life where career is going to be far more important to you. I think, the WIR group for me has definitely shown me that women take many different paths to success, and success is defined differently for every single woman.
Yeah, I love that. I think that's so true. And I think that's reflected in our course throughout residency too. It's everybody has different goals. Everybody is looking for different opportunities. And I think Women in Radiology has, our group certainly, but I'm sure many groups throughout the country have space for all of that. All the levels of support that you might need.
Absolutely. And I think we've been so fortunate that we have a female department chair, because there's not a ton of them in the country, and that she realizes that the career trajectory is going to look different for every single woman who's under her.
Yeah, absolutely. And that's the importance of diversity, right? Of having a female chair is I think has been a real game changer for our department. So it's really nice to have that perspective and that opportunity for all of the women in our department.
Absolutely.
What do you feel are the most impactful initiatives you've been a part of through Women in Radiology?
My gosh, we've offered such great stuff over the years between the social events and the book clubs. But I have to honestly say that without a doubt that my favorite has been the faculty spotlight.
Mine too.
So, bringing in a guest radiologist, whether it's an internal faculty member or a visiting female faculty member, has been so educational. That person, as meets with our residents over lunch, and over the course of an hour, the residents and whatever attendings are free to join are able to learn about her career trajectory. And, being able to ask questions and receive information and advice that may help with their own professional development, I think is huge.
Yeah.
So, we've been, when I think back over the years, we've had female chairs of radiology departments. We have deans of medical schools, an expert in global health. I mean, that's just to name a few.
Yeah.
So, I mean, I would have loved in training to have had that exposure to that many diverse women.
And I think that speaks to what you said about so many different paths to success. We've had women who have spoke to us about how they worked part-time for years, and then when their kids got older, went full-time and ascended to the level of department chair, or women who have been very embedded in academics throughout their whole career and really successful in publishing and climbing that ladder, and women who have worked in the community and have been really successful in mentoring because that's what they're passionate about. So I think we've been able to see for ourselves all these different paths that we can kind of emulate or see ourselves in. Because again, I think one of the challenges of medicine in general is that there are so many avenues that you can definitely find a way to love your career and be happy, but you have to find it. So I think it really helps identify those opportunities and those options and those different scenarios for trainees and young faculty members. We invite, as you said, our fellows, our faculty, and we've definitely had our younger faculty members participate in those as well.
Absolutely. I mean, I think hands down to me, those have been some of the most, gratifying lunches and high impact lunches in terms of the value and knowledge gained.
Absolutely. And I think it's a unique opportunity to focus on something other than the clinical work. A lot of the times when we have grand rounds and when we have all these, different academic focused talks, we're really talking about someone's work, but it's really nice to hear about their background and their career and kind of have a very different conversation than we're able to have when we're focused on the clinical work. So I think those are very unique opportunities as well that we don't get day to day.
Right, absolutely.
Well, thank you so much for this conversation. I really appreciate your time.
Thank you. It was really nice to spend a few minutes with you talking about WIR.
Oh, my favorite. Thank you for listening to this episode of the Women in Radiology series of the RSNA's Imaging Cancer podcast. Please rate, review, subscribe to the podcast, or check out the journal website for articles on this topic and more.